Hi everyone, my name is Ashley Cross, and the organization I chose to do my project on is Akron Children's Hospital. This slide is going to cover some information about Akron Children's Hospital. It actually has two hospitals, but the main hospital is in Akron, Ohio, and it is a pediatric hospital. It also is more than just a hospital. They have urgent cares, primary cares, and specialty locations all throughout Ohio. And Akron Children's also has 35 pediatric offices all throughout Ohio. And they also employ school nurses for some of the local Akron schools and like Fairlawn too, just the surrounding cities. And in Ohio, Akron Children's is a highly rated and respected name when it comes to providing care, medical care for children. And the health professional that I had help me with the project is one of my former coworkers, and she's an experienced LPN who has worked with Akron Children's for over 20 years. The bolded text are the Joint Commission safety goals, and then the text that is not bolded is how Akron Children supports those safety goals. So the first one is identifying each patient correctly, and Akron Children is probably pretty good about that because they use two patient identifiers, and each patient when they come in for their appointment is asked for their full name and date of birth, and they verify it, and after it's verified they are given a bracelet that has their name and their date of birth on it, and it also has a barcode on it, and that barcode is also used for things such as scanning in medication, and it's just another step to verify the patient identity. And two is preventing infection. And Akron Children's trains their employees on proper hand hygiene and regularly provides updated training on hand hygiene. And the third one is improving staff communication. And Akron Children trains their employees on providing speedy results. And at least for the office that I worked at and in the hospital, there was an on site lab that provided testing results the same day. So someone would get tested there at the office, and then their results could be sent up the same day with the result later that day. And four is identifying patient safety risks. And Akron Children's staff is trained to recognize the signs of depression and suicide in young teens and older teens, which can vary depending on the age. And each child over 12 is also given a depression screening at their yearly exam, their yearly physical. And if the patient scores high, the test is flagged and further action is taken. And this slide covers the safety goals continued, and five is to prevent mistakes in surgery. And this is supported by the use of the two patient identifiers and wristbands, and they also promote a safety culture. And six is using medicines or medication correctly. And I touched on this a little bit earlier by noting that every patient that comes in has a wristband and they have a barcode on their wristband. And when medications are scanned in, we did have scanners at the office and we were trained to go ahead and scan the barcode on the medication because every medication had a barcode, first of all, to make sure it's a not to make sure it's the right medication and it's not expired. And then we were also supposed to scan the bracelet to make sure it was the correct patient. And seven is using alarms safely. Akron Children's provides alarms on their medical equipment, and the medical equipment is tested regularly and inspected to ensure it's working. And because of all this, Akron Children's passed the national checklist for the Joint Commission for their 2020 safety goals, and they also promote a safety culture and provide regular training on safety updates. How does Akron Children's safety goals compare? So, as stated in the previous slide, Akron Children passed the nationwide comparison. And this is the comparison for the Joint Commission. And again, in the previous slide, the bolded text are the Joint Commission's national patient safety goals, and the non-bolded text is how Akron Children supports the hospital national patient safety goals. So the aspect I chose to further analyze is one that supports identifying patients' risk, which again was one of the 2020 safety goals. And what I'm going to further talk about, it's an annual screening that is given to any patient over the age of 12, so 12 included. And the screening is called CRAFT, and it is given to patients at their yearly physical exam. And the goal of the screening is to kind of tell if a patient has been exposed to or has been using dangerous substances such as drugs and alcohol. So this slide is going to cover what exactly does CRAFT cover, what is included in this assessment. And these aren't word from word, and it's not everything that's in it, but it is the general idea. So they ask the patient if they have ever been in a car with someone who was using substances and if that person was driving or a passenger. And now this could include the patient, a friend, a family member, a parent, anyone in the car. Also, it asks the patient if they have ever used a substance to help them relax, sleep, or focus at school. And of course, this does not include any medication that is prescribed to the patient, just something that they're not supposed to be taking. It asks them if any family members or friends have used substances around them, and also if they've ever felt unsafe or uneasy when friends and family member have used substances around them. And it also asks a patient if they have ever felt pressured, it could be peer pressure or by friends into using any substances that they did not want to. So why is craft important? It's important because it can spot early detection of drug and alcohol abuse in patients, which again are young teens and older teens, and it can also spot if a patient is being exposed to substance abuse and if they are at risk. And according to Akron Children's, an alarming rate of substance abuse is occurring within our communities, and the evidence suggests that early screening and detection of substance use and abuse allows for earlier treatment interventions and will reduce long term risks of substance abuse. And the purpose of CRAFT is not to punish or expose patients for anything that they have done, but it's to help intervene while they're still young and provide them with the necessary resources or help they need. This slide is going to cover CRAFT's launch in its goal, and it was launched in April 2020. And its completion goal for the year was to have 80% of the patients who are eligible for the assessment take it, and the monthly averages were tracked. And these are the results. Again, in April 2020, it was launched. In May, it had an average of 44.5% completion. June was 91%. July got a little bit higher at 93%, and it really peaked in August at 96%, lowered a little in September to 93%, and then peaked again in November at 95%. And the last month was December 2020 at 96%. And the conclusion is that Kraft maintained a consistent rate that passed its goal 6 months after launch. So this slide is going to cover how exactly the assessment was given and how the data was collected. So the patients were given a sheet of paper, which was the craft assessment that was placed face down in their exam room on a clipboard, and this also included on this clipboard a depression screen. And the patient was to take the assessment and place it face down so no one else could look at it. Like sometimes the parents or the siblings were in the room with the patient, especially the younger patients, 12, 13, 14. And the provider is the one that looks at the results first. And after the appointment is complete and the provider leaves the room, the MA or the nurse that was working with the provider would chart that the test was complete, but they would not chart the results. And the results are kept between the patient and their provider. And listed here are just some possible issues on how the data was collected and how the assessment was given. So, as mentioned previously, the parents are often in the exam room with the patient, especially the young teens. And even though the fact was stressed that the screenings the patient were given were supposed to be private, many times the parents may view over their shoulder, or the patient, may ask the parent if they don't understand the question, especially some of the younger patients. And with the parents looking, this could pressure the patient into being untruthful. And there's also the chance for human error that the MA or nurse working with the provider forgot to chart the completion. And when it was charted, it was just literally a little box that you would click to say the assessment was given. None of the results or anything were ever put into the patient's chart. It was all private, just between the patient and provider. And because of this, the MA or nurse may forget to give the assessment and then just click it out of forgetfulness to finish the chart. So, in order for data to be accurate, it must be valid. And what I mean by this is bringing up some of the issues listed on the previous slide, there are clearly some aspects of the collection process that can bring the validity of the results into question. And according to SPATH, accuracy also relates to the validity of the measurement. Validity is the degree to which the data or results of a study are correct or true. And therefore, this means that there is room for improvement with the administration process of the test and the data collection. And these are just some improvements that could be made. So, again, the assessment is given to patients during their annual exam when their parents are present, and it is just placed face side down. And instead of this, a cover paper could be placed on top of the paper, which kind of highlights the importance of the patient taking the exam without the parent watching. So, it could state in a way that the parents and patient understand what the exam is for and why privacy is important. And you have to consider too, the parents may feel uneasy not being able to see what their child is answering. So the provider and the MA or the nurse should explain the importance of craft, why it is given, and they also should highlight on why privacy is important, because if the questions aren't answered accurately and truthfully, even if there's a high data completion, it's defeating the purpose of the assessment, which in the first place was to be able to spot the early signs of a young teen being exposed to any drugs or alcohol and being able to step in and intervene before the problem got any worse. So the last slide covered possible improvements that could be made, and this slide is going to cover some improvements that were actually made while I was employed there. So again, I worked during the launch as a medical assistant, and the nurses and the medical assistants and the providers were all told the importance of craft, why we were giving it to patients. They were told the goal, and we were told how to chart it. And at first, there was really no incentives or double checking to make sure the assessment was given or charted. And we worked at a very, very busy office and were often short staffed. So this was kind of viewed as by the clinical staff as first is just kind of like an extra step, and oh well, it's something extra we have to do and something extra we have to chart. And there was really no double checking. There were no incentives or anything to kind of help remind us to do it, because again, it was a new process. And then looking back at the graph, that was in May when the completion rate was very low. It was at an average of 44.5%. And then in the following month of June 2020, there was double checking. The manager was actually going through the patient's charts, the ones that were over the age of 12, and she was checking to make sure that the assessment was given, and if it wasn't, we would be given reminders or asked like why it wasn't given. And there was could be various reasons. The patients don't have to answer anything they don't want to, so there was some parents that felt uncomfortable with the patients being giving the assessment because it did mention drugs and alcohol, and there was also some patients who did not want to take the assessment. So those were also then they would be charted, such as the patient refused the assessment, the parent did not want the patient to take the assessment. So those would be taken into account instead of just it being left blank. And there was also incentives for the employees. There was If they got a certain percentage, there was actually a bonus, or there was we could get like a Starbucks gift card. There was one time that we got the manager had bought lunch for the whole entire office. So they really did kind of, step up their game, and they improved. It is seen in the data that they really did improve the completion rate, because all the other months following up until December of 2020 were all over their goal of 80%. So this slide is going to be my conclusion and what I learned. And some things I learned along the way are: just because a quality improvement reaches its numeric goal, it does not necessarily mean it's successful. There are many aspects that need to be taken into consideration, and these are just a few. How the data is collected, who is collecting the data, and the process that goes along with it. And data collection is important for quality improvements because different measures can be taken to improve the process. And the conclusion is the craft assessment completion rate started out slow, but with changes in the process, as what I've listed on the previous slide, it completed and maintained its goal and scored even higher than the 80% completion rate. And this slide is going to cover what I could have done differently in regards to how I conducted this project. For the most part, I am satisfied with the completed project. Now that I'm thinking back, there are a few things I would have tried to obtain. One would have been a current copy of the craft assessment, and also further research into what resources are offered to the patients who score high. And there is one thing I'm curious about: if the craft assessment is still maintaining its high completion rate. And this slide just includes my works cited. The first four are all the sources that I got my information from, and the last source is just where I got pictures from. And that concludes my presentation. I hope everyone enjoyed it, and for everyone who made it this far, thank you for watching.